It is now my honor to introduce our keynote speaker, Dr. Jon LaPook. Dr. LaPook is Chief Medical Correspondent for CBS News and Mebane Professor of Gastroenterology at the NYU Grossman School of Medicine. He practices internal medicine and gastroenterology at NYU Langone Health. Dr. LaPook's career sits at the intersection of medicine, media, and public health. As a physician and broadcast journalist, he has worked since the beginning of the pandemic to keep the public, as well as his own patients, informed about how to stay safe. Dr. LaPook has a special interest in using media and the arts to improve medical training. In 2014, he founded the Empathy Project, which produces short films and other educational materials to teach clinicians to be more effective by practicing empathy. Since joining CBS News in 2006, Dr. LaPook has contributed more than 1,200 reports for shows including CBS Evening News, 60 Minutes, and Face the Nation, and has won numerous awards. Welcome, Dr. LaPook.
Well, first to call an audible. Wow! Okay, this is not in my speech yet, but wow. Look at these wonderful faces. And the second audible, which I just found out about in the last few days, is where's the camera? Dean Williams, Michelle, feel better, get better soon, we miss you. Thank you, Dean Kim, for that kind introduction and for inviting me to address not one, but two classes of the Harvard T.H. Chan School of Public Health. I also want to thank Dean Williams and the terrific staff responsible for organizing these commencement events. Congratulations, graduates. Woo! You can feel it. You can feel the vibe. And you were all out there for a year or two sort of getting it going, right? Getting the wheels turned. So you got a little amuse-bouche of what it's like to be in public health. I hope your bouche is amused. Think of all the hard work you did to get here today, all the support you had from your family, and thank you, family, and friends, and teachers. I applaud every one of you. It's been pointed out that there have been several commencements for you, especially a privileged group of people. I did my homework and I watched the online commencements that you attended virtually in 2020 and 2021, the years of your actual graduations. The pandemic may have delayed your in-person commencement a year or two, but we all know that good things come to those who wait. And I'm told your third commencement next year is going to be astonishing. So just, I recently interviewed your remarkable dean, and she is a remarkable dean. Do you have any idea how lucky you are? She's amazing. I interviewed her for a CBS Sunday morning piece about the state of public health in America, and she told me, of course this will come as no surprise to any of you, that as a nation, we have underinvested in public health for decades. The pandemic has been a stress test that's highlighted fundamental problems, among them healthcare inequity, of course, inefficient ways of gathering, analyzing, and communicating health data, and lab systems that fell far behind our need for testing and surveillance. And making things worse, an epidemic of misinformation and, yes, disinformation, infecting the national conversation. All too often, facts have taken a backseat to personal or political beliefs. Public health officials have been ridiculed and even threatened with physical harm. We've all seen that, and we've all heard it. Given all that, why is it that in the last 2 years, applications to the Harvard T.H. Chan School of Public Health have soared by 67%? I'm guessing it's not because of the big bucks that await you in this field. No? Am I wrong? Maybe. My theory is what has brought you all together, what you share, is a gift for empathy. And empathy is what I want to talk to you about today. As Dean Kim suggested in that gracious introduction, my career sits at an unusual intersection of medicine, journalism, and public health. As a practicing internist and gastroenterologist, I take care of individual patients. As chief medical correspondent for CBS News, I report the news. But in that role, I'm also committed to improving public health by educating viewers about the connections between their own health and the health of the country, sometimes even the health of the planet. But no matter what hat I am wearing, I've come to understand that no credential in any field is as crucial to success as the ability to experience and practice empathy. Empathy is your superpower. It's your superpower. So I want to tell you some things I've learned about it from my own experience as a physician, from the great Dr. Paul Farmer. From workers in the COVID wards during the early days of the pandemic, and even from my children. 9 years ago, I came to the NYU Grossman School of Medicine to start something called the Empathy Project. We bring together leaders in medicine, education, entertainment, and technology to promote empathy in healthcare using Hollywood-quality short films. At empathyproject.com, you can see our latest. Not now, later. But go to empathyproject.com. Our latest is a 7-minute animation called The Elephant in the Waiting Room, and it focuses on implicit bias and racism in medicine. You'll get to meet Denise, the empathy elephant, voiced by Whoopi Goldberg, no less. Thank you, Whoopi. Who gently nudges our protagonist, voiced by Ed Helms, thank you, Ed, to follow an empathetic path. We almost played a clip of it. We decided not to because it's about 7 minutes, and we didn't want you seeing something out of context because we took 1.5 years for us to do that, and we want to make sure you see the whole thing and not out of context. So what is empathy? Definitions vary, but at the Empathy Project, we define it as the practice of authentically trying to understand another person's lived experience through communication, and more specifically through engaged curiosity. Think of it. That is exactly what you will be doing in the field of public health. Authentically trying to understand another person's lived experience through communication and engaged curiosity. People respond to empathy. It turns out patients who experience their caregivers as being empathetic have better outcomes than those who don't. They're more likely to follow advice, for example, to manage their diabetes correctly. Empathy can help us identify and minimize implicit bias. It can improve communication. It can help to establish trust. Right? Where is truth without trust? You can have the truth, you have to have the trust. But empathy also needs to be nurtured. Research shows empathy in medical students tends to start out high, but can wane during clinical training for a number of reasons, including burnout. Let me give you an example of someone whose empathy never faltered and who famously turned it into action. Dr. Paul Farmer, a giant in the field of public health, whom you all know. You all know him, and whom we recently lost. I met Dr. Farmer soon after the deadly 2010 earthquake in Haiti. I had been doing a story for CBS News in Port-de-Paix in northern Haiti, the poorest part of the poorest country in the Western Hemisphere. I was in a one-room combination neonatal ICU and delivery room. To my right was a premature baby boy, you can still see him, clinging to life with the help of the one portable oxygen machine they had, the oxygen concentrators that Dean Kim mentioned. So to my right was this premature baby with the one and only one oxygen machine in the room. To my left was a woman in labor. Suddenly, her unborn baby's pulse dropped. Suddenly, the unborn baby's pulse dropped. After a few minutes, the oxygen machine was wheeled from the premature baby to the woman in labor. A Sophie's choice, right? The woman in labor delivered a healthy girl. The premature baby died. In the United States, that baby would have had more than a 90% chance of survival. And when I told Paul Farmer what had happened, he was outraged about yet another example of people being victims of tragic healthcare inequity. But Paul was uniquely talented at harnessing his empathy to make the world a better place. 2 years after the earthquake, I interviewed him in central Haiti in a brand new, state-of-the-art hospital made possible by a collaboration between the Haitian government and Partners in Health, the terrific organization he co-founded. And as we walked through the halls, there's that hospital in Mibale in central Haiti. As we walked through the halls, just before the hospital opened, so there were no patients in it yet, we stopped in what would soon become the maternity ward. And this is a clip of what Dr. Farmer said. Look at your monitors.
This is a serious problem in healthcare delivery, is setting standards based on whether or not someone's poor or a country's poor. People living in poverty and with sickness deserve something better than what they've been offered, which is the sharp end of a stick.
What do you and your colleagues hope that you're giving birth to with all your efforts?
We want to be able to say, just once that the quality of care we're giving to people living in abject poverty is as good as it would be if they were born in some ritzy part of Manhattan, say. I mean, that vision of equity and justice and decency is what we'd like to give birth to.
What's so remarkable looking back at that is he summed up his entire life's mission in that one sentence. And I urge you to go back and look at that clip again. It's posted and you'll be able to see this, but we miss you, Paul. What comes across to me so powerfully in that clip is that Paul was personally offended by healthcare inequity, personally offended. And he channeled his world-class empathy into a sense of, and his world-class sense of decency into passion and action. 3 years later, in 2015, in that very same hospital in Mibale, I watched as conjoined twins were successfully separated, the first time that had ever been done in Haiti. It shows you, give that applause. It was amazing. It was amazing. And it shows you what being personally offended can lead to. So, personally be offended. With control. There was only one Paul Farmer, of course, but there are lots of ways each of you will be able to make a difference. And I believe it will depend in large part on how well you're able to nurture your empathy so you can use that superpower. Obviously, having empathy can make you more vulnerable. And I was truly shaken by that first story in Haiti and the death of that premature baby. I still am shaken. When I told Dr. Farmer about it, he gifted me with a masterclass in empathy. He gently asked me how I was holding up after such an upsetting experience. He knew and was teaching me that we not only have to have empathy for the people we're trying to help, we have to have empathy for ourselves and for one another. This is so important. It's a lesson I wish I had learned earlier. In March 1981, I was an intern in New York City when I saw my first patient with HIV/AIDS. He died, and for years, so did all my other patients with AIDS. Every single one. Every one. And then in 1987, the FDA approved the first effective drug to treat AIDS, AZT. Gradually, over the years, treatment improved and AIDS became a more manageable chronic disease, though still often devastating. Over the next 30 years, images of those brutal early days remained with me, but mostly stayed in the background. Then 11 years ago, I saw The Normal Heart, a gut-wrenching play by Larry Kramer about the early days of the epidemic. And at the end, the names of people who had died of AIDS were projected on the walls of the theater. I couldn't move, my eyes filled with tears as the sadness of that time came flooding back. Now, those memories were a big reason why, in April of 2020, I helped out on the COVID wards at NYU Langone Health, where so many patients were dying despite all our best efforts. I wanted to share what I had learned with the young students, doctors, and nurses who might be feeling as helpless as I had felt in 1981. Well, they were way ahead of me. These young clinicians in training already understood it was okay to shed a tear or two, not decades later as I finally had, but in the moment, the end of the day, not 30 years later. And it was okay to take advantage of mental health services to help deal with the stress and avoid burnout. My advice to you is to be very aware of the enormous challenges you will likely be facing. It's essential to help yourselves if you want to enjoy a long and productive career helping others. Reminds me of in an airplane, right? When the oxygen drops, you put your own on first, right? So you can then help the person sitting next to you. You're going to be in the unenviable position of getting little or no credit when you do your job right, as has been pointed out already. During the CBS Sunday Morning interview, I said to Dean Williams, "Well, it sounds like when the healthcare system is working well, you don't notice it." And she answered, "Yes. When public health works, nothing bad happens, so you don't notice that the child that had a spill on the bicycle got up and is just fine because they're wearing a helmet. On the other hand, when things go wrong, you're going to be in for a world of criticism. And that is why having empathy for yourself and for each other is going to be so essential. You are entering a profession at a time where it really needs you. And when the tools for helping people have never been more powerful. At the top of the list during the pandemic of new tools has been the technology that gave us, within months, safe and effective vaccines. Of course, as quickly as you can say messenger RNA, the pushback began, right? Benjamin Franklin went to his grave regretting that he hadn't given an early version of the smallpox vaccine to his 4-year-old son who died of smallpox in 1736. But in recent years, the pushback has gotten exponentially worse. During the pandemic, I've gone on the air at CBS News talking about the importance of embracing science. But how do you convince somebody who is absolutely certain they are right and you are wrong? As we've seen, there's no easy answer, but I think it starts with humility. And it absolutely requires empathy. Let me explain why. Maybe they are right and you are wrong. It's possible, right? And it's important to recognize when this happens. That's where humility comes in. Here's an example. Only recently have public health officials begun to adequately acknowledge the role of aerosols in spreading the SARS-CoV-2 virus far past the 6-foot guideline for so-called social distancing. But aerosol scientists, including Joe Allen, who's in the audience here, and Kim Prather, and Lindsay Marr, and Don Milton, and so many others, they were all jumping up and down as early as the spring of 2020 that said, COVID is airborne, that an infected person can spread virus through tiny particles that float across the room like cigarette smoke and build up over time, especially in poorly ventilated spaces. They suggested an obvious solution: improved ventilation and air filtration. That should have been a public health priority, but it took way too long for officials to embrace the science and admit they had been wrong. Now, I'm guessing most of you already understand that when you're disagreeing with somebody, you could be wrong and they could be right. But what if you're definitely right? They're definitely wrong. You're saying 2 + 2 = 4. And they're certain that 2 + 2 = 5. And that's where, and here's that word again, empathy comes in. Why empathy? Well, let's say scientific truth brushes up against their firmly held belief. I remember how my son Noah felt in exactly that situation. Imagine this. When Noah was about 4, he's now 26, he asked us if there was really a tooth fairy. My wife, Kate, and I fessed up, and he fell to the ground on his stomach, banging his hands on the floor in one of the major tantrums of all time. After a few minutes, the crying died down to the point where he was just intermittently whimpering. You know that state, right? At which point, my then 8-year-old son, Daniel, knelt down, rubbed Noah sweetly on his back, and said, "I know just how you feel, Noah. I felt the same way when I found out there's no Easter Bunny." There's no Easter Bunny! And banging on the floor again. To Noah, that was a full-scale assault on his belief system. So please remember this as you try to change somebody's mind. New Zealand's Prime Minister, Jacinda Ardern, empathetically understood the power of belief and her public health responsibility to all of her constituents when, at the beginning of the pandemic, she declared the Easter Bunny and the Tooth Fairy to be essential workers. Millions of parents breathed a sigh of relief. Sadly, public health advice has become so politicized, so polarizing, that respectful, kind, and productive conversation among people who strongly disagree has become a rarity. There's been a regression to the mean, and I'm not talking about statistics. Being mean has no place in debate, and each and every one of you has an opportunity to help change that. Now, thank you. For sure, there are people you will never reach, but you can still be ambassadors for an empathetic approach. And modeling that approach has value even if you fail to change somebody's mind about a specific issue. Way too often, conversations begin with people coiled, ready to strike. An empathetic approach begins with people uncoiled, ready to listen. You've been studying about public health during, of all things, a pandemic. You've had a front row seat to witness what's gone right and what's gone wrong, not just here, but around the world. And we're going to be trying to recover from it for years to come. Fortunately, you graduates will be right in the middle of that healing process. I hope our leaders, and that's going to include you, have the humility, common sense, and commitment to take a hard look at the last 2 years, learn from them, and invest in a stronger, reimagined public health system. You have had a first-rate education that has helped give you the power to do great things. And as we know from the Spider-Man movies, with great power comes, everybody? Great responsibility. Front goes here. The hardest part of this speech, which it took me 3 months to write, I've never worked so hard on a speech, has been putting this hat on. And I love that you all knew, of course you all knew, with great power comes great responsibility. And that brings us back to the superpower of empathy and the example of Dr. Paul Farmer as someone who undertook that responsibility wholeheartedly. He had the courage, bless you, Paul, to stand up for what he believed, the honesty and humility to admit when he was wrong, and the decency and empathy to remain personally and passionately offended by injustice. And he had an amazing sense of humor, not taking himself too seriously. I wish that for all of you. I'm going to take a wild guess and say if you're going into public health, you've got more than a little bit of idealism in you. Yes, there will be challenges ahead, and some of you will see things that will break your heart. But you have chosen a career, think of it, in which you can love going to work and get real joy from what you do. How great is that? It's great. My son is working at Lululemon right now. I mean, he's an aspiring actor, and it's not his life's goal. I mean, he does it, but you're going to work in a field right now where you can have fun. And having fun is part of it. It's important. Part of that not burning out. I have one last piece of advice. Enjoy this moment. When my mother was about to peel an orange, she would say, "At this moment, this orange has never seen the light of day." Right? This orange, this moment. Today it would be called mindfulness. Back then it was just my mom peeling an orange. So cherish this tremendous moment of accomplishment. Keep nourishing your superpower of empathy and go make the world a better place. I know you can do it. Congratulations, everybody.
Thank you, Dr. LaPook, for your inspiring words.